I'm Dr. Shrikant. I would like to tell you in short about how we actually plan our cases which have actually come down to us, and I'd like to discuss with you in short about one of my recent videos which I've just taken, that how can you correct the procline teeth without removing your premolars. Now, usually when you ever meet an orthodontist in general, what they actually say is, please remove your corner teeth, which are your first premolars, just behind your canines. Now, this makes it very simple for deranging the scenario or aligning the scenario and taking them back. But there is another option with Invisalign as to what has been very successful in the recent past, and we have been doing very good number of cases with that, and the prognosis is really good. Now, in this short session, I'll be telling you about how the distalization is actually planned up, and I'd like to show you a small claim check, is what we call it, the video simulation as to how we actually move your anchor teeth. Now, just a small recap, anchor teeth are nothing but the teeth which actually we take support in order to bring your front teeth back. But in this particular scenario, what we actually do is we shift your anchor teeth back, which is distal, and then create space for correcting your procline incisors. Now, come down to the video. Now, this is how the patient had come down to us with severely proclined upper front teeth and the lower front teeth, if you can just appreciate them. Now, I'd like to show you a small video simulation as to how this actually goes on. Now, just focus on these teeth. These four teeth are the anchor teeth, and these are very important for your biting. Now, or chewing. Now, if you see the video, you can understand that the anchor teeth are going back symmetrically, and that's how then we create space for the premolars to go back, and then the canines, and then followed on by the incisors. Now, in this particular fashion, we bring about the correction of your front teeth and into your desired position. Now, some of you can definitely have a doubt, Doc, how much amount of millimeters or how much has this ever got corrected? Now, we have another important tool on Invisalign side where we can actually show you as to what is the amount of correction as to when we started off and what we ended, and this is called a superimposition tool. Now, the superimposition tool comes up with a blue line. Now, if you just click on this particular scenario, now this is the superimposition tool. Now, the blue thing which is there on my video or on my screen is nothing but the front position or the initial position as to how the patient has walked into our dental practice. Now, if I just deselect this option, just see the change. Now, this is the change. If you see this is the pre-position or before the treatment position, and this is the tentative position what we can achieve once your aligner therapy is done. So in this particular case, what we could actually attain a change is almost around 5 millimeters, and I would say this has been really good. And now this is my 15th case with distalization, and I'm expecting tremendous change.